Individuals with SM and many that struggle with anxiety crave inner control. Some of the things this child is saying, the first part is her needing the control, and the child doesn't feel understood and doesn't feel that compassion. And so they're almost internally angry at their family members.
Welcome back to another episode of Unspoken Words, Selective Mutism podcast hosted by Dr. Elisa Shippon-Blum and the Smart Center, produced and published by New Edition Productions. This episode features our latest installment of our Ask Dr. E series, where we answer real questions from our listeners. In today's episode, we answer 5 questions, including how to deal with contamination, if your child's impatient, demand-driven behavior may be a sign of OCD, if it's possible to develop SM at home, but not at school, and more. Before we get started, if you have any questions on anything you hear in today's episode, we want to answer them. Please head to selectivemutismcenter.org/ask Dr. E and enter your question in the form. We read all your submissions and do our best to answer them on podcast episodes, blog posts, and on social media. And speaking of social media, for the best of this episode and every episode of Unspoken Words, make sure you're following the podcast on Instagram and on YouTube. We are at Unspoken Words _podcast over on Instagram and Unspoken Words podcast by Dr. E on YouTube. So without further ado, please enjoy the latest episode of the Unspoken Words podcast.
Hey everyone, it's Dr. E. Before we get started with today's episode, I have something really exciting to share with you. On Friday, April 4th, 2025, we'll be hosting our all-day Selective Mutism in the School virtual conference offering 6.5 continuing education credits for professionals attending. We've put together an incredible lineup of selective mutism experts and will discuss the assessment, development of accommodations, interventions, and strategies to help the child and teen with selective mutism, social anxiety, and shyness speak in school. So mark your calendar, April 4th, and if you're a parent, be sure to share this opportunity with your child's school staff, doctor, therapist, so they too can attend. Registration details can be found on our website, www.selectivemutismcenter.org, and in the description of this podcast episode. Together, we can create a world where every child has a voice. Now, enjoy the episode.
Hey, Dr. E.
Hey, Brandon, how are you?
I'm doing good. I think if you're tuning in this episode, you just heard an ad for the SM in the School conference in April, which I know we're really, really excited about.
Yeah, super excited about it. We get so many requests for trainings, and we decided to put a 6.5-hour presentation together geared towards SM in the school. And if you can't attend on April 4th, we will have a self-paced course available afterwards. And what's great news is it also, as mentioned in the ad, has continuing ed credits associated. So for professionals that want to attend, and most disciplines that you can even think of can get continuing ed credits. So super excited. We used to do them a lot before COVID, and now we're back in.
I was going to say, it's the first one that you guys are doing since 2018, right?
It's the first one, but it's also our very first virtual conference. Like, we used to go in person and do them. I would travel all over the country, but it's virtual world now, and it allows a lot more people to attend from anywhere and everywhere, all over the world, actually. So we're super excited, and I'm excited for this podcast. There's some great questions that some of our listeners sent in. So let's go.
Yeah, so we have 5 questions for our listeners. This is our first Ask Dr. E of 2025. One of our most popular segments in 2024 was Ask Dr. E. So we're really excited. As we were talking before this, we have some really great questions here. So I'm excited to ask them. You ready to go?
I am ready to go.
Okay, so question number 1. How do you deal with contamination?
So I know contamination is a really common and popular word in the SM world. And what it implies is that there's an environment where a child is relatively stuck. So they see that an environment as a place where they don't talk. I don't talk there. The most common contaminated environment, if you want to call it that, is school. So that's where a lot of the kids will have the most difficulty in terms of making progress. And the word contaminated, in my mind, I'm not a big fan of that word. And I know that it's out there, and I see it as an area you're stuck. And so it's not an area you just like ignore. It's an area that you assess and understand, why is that child or teen stuck in that environment? Why do they see themselves mute in that environment? Sometimes it's really as simple as, everyone knows I don't talk there. Not that that's simple, but what I mean is that's the explanation. It's certainly not simple. I
Mhm.
don't talk there, so everyone's going to make a big deal if I do talk. And so that can lead to, I just stay mute because I don't want to bring attention to myself, especially knowing so many of our kids and teens are socially anxious. So you're bringing attention to yourself if all of a sudden you start talking. So the way we handle that word or that situation is, when we're assessing an individual's why they're not talking in an environment, or why they're having difficulty communicating in general, and what are their baseline stage. And in this case, it usually means they're nonverbal. They may not be overly initiative, maybe they are, but they're nonverbally responsive. Maybe they're quietly verbal with one or two, I'm not really sure, but they're more stuck in that environment. That's where we have to focus our treatment. That's where we start with their baseline stage. That's where we train the teachers to begin, rather than kind of pushing or encouraging to speak if they're not yet ready. One of the things that's really a difficulty is the idea that selective mutism is about just not speaking. And therefore, the approach is, let's do whatever we can to encourage the child to speak. And we often will put it on the child and say, listen, you need to be courageous and brave to talk. But what if that child can't? So I don't want to say that they're stuck there. It's more or less they're not able to at that time. So it really comes down to tailoring strategies and interventions to the child, meet them where they're at, talk to the child about it. Again, I often, work with families where when they come to the Smart Center, they'll say, no one really ever talked to my child about it. We didn't talk about it. We kind of ignored it. Or we only really did focus on trying to get them to talk because they seem fine everywhere else, or they seem fine. So the key to this is knowing where they're having the most difficulty, or the difficulty in general, and starting to develop a treatment plan that will accommodate them with their starting point, and then alter strategies and interventions. So contaminated often means they're professional mimes in an environment where they look comfortable. They can kind of run around, smile, interact perhaps, but they're mute. This is where the transitional stage of communication is really, really powerful. Using purposeful strategies, such as the use of a verbal intermediary in a very structured way. Sometimes it's starting out of the room. Sometimes it's moving in the room in a very controlled manner. Sometimes it's using sounds to words, all the way up to a very ritualistic, unlearning mute behavior by shaping sounds into words. Our children tend to feel out of control. So much of SCAT, this CBT based program, is all about providing control to them. So even in an environment where they're stuck, quote unquote, contaminated, you have to talk to the child about it. The visual of the bridge is beautiful because they can see where they are, and we can start step by step by helping them unlearn their conditioned mutism. And that involves training parents, but it also involves training school staff and educating others to meet them where they're at and get them involved. This question doesn't focus on it, but there's something called acknowledgement, assessment, and taking action. I call it AAA. And acknowledge it means I know something's difficult and I can rate that difficulty, assess it, and now there's going to be action taken. So every child, whether they're relating to a scary feeling or it's hard to do as they get older, needs to acknowledge that this is hard or scary. Maybe it's
Mhm.
using words. Maybe it's pointing or nodding. Maybe it's turning to a peer and saying the word yes quietly, whatever it might be, but it's acknowledging it and then trusting that child while they assess their difficulty, not disrespecting them by saying, no, 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 you can do it. You can be brave to talk. There's
Mhm.
kids ready to be verbal, but there are a lot of kids, and we see a lot of those kids that are not ready to talk yet. But trust me,
Right.
they will.
So real quick before we move on to question number 2, contamination in this context doesn't refer to like something being dirty or polluted or something along those lines?
If you think of the word contaminated, it implies that that environment is like discombobulated, as you'd say.
Okay.
Doesn't mean it's
Okay.
dirty. It just means it's like all
Right.
kind of confusing and they're
Okay.
stuck. It's like, I don't want to use the word,
Out
so
of sorts. It's
at a
not.
sword, you're stuck
Yeah.
there. It's like there's something
Okay.
holding them up. And
Makes sense.
so if you think about the social communication bridge and you respect where their starting point is, and then you develop strategies by taking them from their baseline up and training others to implement and talking to the child about it and the
Mm-hmm.
teen, then
Mm-hmm.
you will overcome it. I've never had a child I've worked with where they could not overcome it in an environment if we worked with that child and family and we worked with the school, because it's really
Okay.
unlearning their conditioned mutism. And you know what? There are some children that have to go through a process of writing letters to friends, even if they never send it, for example, what they'd want those kids to know if they heard their voice, or would you help me, do these games or strategies to help me be able to progress into speech, or however we write that or they write it. And it doesn't mean they send it, but it's really about meeting that child where they're at and helping them understand what is it about that environment that makes them so uncomfortable. And sometimes it's teachers misunderstanding. And once you train teachers, all of a sudden, by educating teachers, the child feels more understood and meets them where they're at. And that contaminated environment becomes very uncontaminated. And then they begin to make progress quite easily. So I think it's really getting all your ducks in a row from every perspective.
Let's move on to question number 2. This is going to be a 2-part question. My daughter is 6 and has SM. She is also very impatient when asking for things. She won't do something until we give her what she wants. She also has negative thoughts about others and misunderstands others as wanting to hurt her, especially other kids. Are the above 2 behavior issues related to OCD, and are they treatable?
Well, this is a loaded question. There's so much here. We probably could spend the entire podcast talking about this question because there's so many directions we can go. There is no clear answer without having an evaluation for that child, because I think of many things. One of the things you said in part one was basically the child won't do certain things until you do certain things. Basically, I won't do that till you do this. To me, the first thing that comes to mind, regardless of the whys of SM, regardless of SM in general, what is your parenting style with that child? The best type of parenting in general is authoritative parenting, where there's a balance between warmth, understanding, compassion with structure, consistency, having boundaries, having rules, but in a kind way. And if you have a child that's all about, I'm not going to do it if you do it, that's kind of, that child is almost like telling you as a parent, and you're kind of, I see it as the child is on the pedestal bossing you around. So right then and there, parenting needs to be a focus. So, I'm a very firm believer in not to treat to speak, but to treat the whole person, and it comes from understanding. So once we understand that child or whomever has selective mutism, their entire, basically who they are. And in this case, parenting is, in all cases, parenting is huge, right? You have to parent in the right way to help these children in general, all kids, not even SM kids, right? Because it will dictate so much about whether they make progress or they don't make progress. It'll dictate their behaviors, everything. So parenting is a focus here. What is the environment like with this child? Does this child have an environment that is structured, that there's a consistency, predictability, routine in their life? Individuals with SM and many that struggle with anxiety crave inner control. Some of the things this child is saying, the first part is her needing the control. So if we can help her environment be in control, right, where she is feeling safe in that environment, knows what's happening, a routine, and there's not like a chaotic way. Even when it comes to interrelationships, there needs to be a way that this child feels safe and secure. So those things I'm just going to put out there. In terms of the child kind of thinking people are hurting her, maybe there's misinterpretation of social skills. Like, does this child have intact social skills? Is she developmentally on par? Or does she misinterpret social skills? Does she misinterpret social innuendos? What is her social pragmatic skill base? Is she able to read? And, when you have a conversation, when you're in a social interaction, is she reading it right? Or is she not reading it right? Is she getting bullied? If she's thinking someone's hurting her, is it possible that at school kids may not be so nice? Are they bullying her? Is she interpreting this correctly? So what I'm trying to say by this question is the parents need to investigate this. Is this in all aspects of her life where she almost plays victim, where she thinks people are trying to hurt her in general? Does she have a maladaptive thought process? she needs an evaluation, but also digging deeper as parents into what her other environments are
Hmm.
outside of the home and the environment within her home.
Yeah, that second part is really interesting to me. Like this negative thoughts about others. Do you think could stem from like an intimidation, a social anxiety of others, and just scared of it? Of course, scared of other people.
Yeah, it could be like immaturity. She's only 6 years old. She's not, and you know, for a period of her life, she was maybe not schooled. So now she goes into school like the last couple years, and maybe she's a little delayed in her social skills. I work with a lot of kids in this age range that are definitely a little bit more immature than, let's say, pre-COVID. And again, the mom mentioned OCD. I don't know. It could be yes or no. I mean, I'm not seeing a lot of OCD, but these are isolated symptoms that could be related to many different things. And so,
Hmm.
what I would say in this particular case is an evaluation is in order to see what might be going on within her and her thoughts, but also her environment. Because once
Got it.
that, like, overcoming SM is not just giving a token to talk, it's understanding what might be holding her back. So until she can feel secure, safe, and comfortable and trust her environment and the people around her, it's going to be really hard for her to take the risks and to do the strategies and interventions to make the leaps, because she's going to keep pulling in for inner control because she doesn't feel in control in, let's say, her environment. So I think you're reading that it's not just about speaking, right?
Let's move on to question number 3. This one's interesting. Do you ever see a teenager develop SM at home, but speak at school clearly and in full sentences?
So we've had situations like this before, and in almost every single case, if there's a child that stops speaking at home, either becomes pervasively mute or speaks to, let's say, one or two family members, but is mute with another, there's some sort of family dynamic at play, whether it's misunderstood, whether they witness something, whether they don't feel safe in that environment for a variety of reasons. That is an area to focus on. Now, they said that outside the home, is this child functioning appropriately? If this child doesn't have mutism outside the home and this child is basically a thriving, happy individual, then it's only manifesting in the home. Some of the things I say, have there been any changes in the home environment? We've had cases where parents have gotten divorced, and then the parent has a new partner, and the child doesn't feel comfortable. Not that that person's doing anything wrong, but they're not comfortable. They're not happy about it.
It's like the house is not a home kind of a thing.
Yeah, exactly. They don't feel safe in their own home from an emotional standpoint. We've had a lot of families over the years where when they've gone through separation and divorce, they'll bring this new partner into that child's life without really understanding that that child may not feel comfortable with that person yet. And they're just like bringing them. Like, we had a case last year where a family came to the center with the person's new partner for treatment, but the child that we were treating barely knew this person or wasn't comfortable with this person. I can go on and on with lots of examples. We've had lots of teens where there's like a real big disconnect, and sometimes it's a matter of understanding. So they feel disconnected. Sometimes the parents are misinterpreting their child. Come on, you can do it. You need to talk. Come on, you can do it. You can get better grades on your test. Meanwhile, the child's struggling in so many ways, and the child doesn't feel understood and doesn't feel that compassion. And so they're almost internally angry at their family members. So let's put it to you this way. Yes, there is a reason though, and that has to be determined. And it might be family therapy, if this child is struggling in other areas of their life, does this child have depression? And is this child manifesting similar depressive symptoms in other areas of their life? So I think it's really difficult for me to get a question and answer it, because there's so many avenues that it can go down based on the responses to these questions that I would ask back.
Yeah, it makes me think about how life there's one constant and it's always change. And so, for example, for this teenager, maybe at one point, obviously he was probably more comfortable at home than he was at school. But then in a weird plot twist, something must have happened, and now all of a sudden he's actually more comfortable at school because it's relatively consistent. And then his home environment is different, and now he's actually more stressed at home, which is interesting. And that must always happen. It must happen.
Right. And maybe he feels misunderstood. Maybe that there's needs to be family therapy, some sort of family dynamic that occur, something that's occurred that doesn't make him feel accepted and comfortable.
Hey guys, we'll get back to the episode in a minute, but I want to remind you that the Smart Center treats more than just selective mutism. I'm Dr. Jenna Blum, lead clinician at the Smart Center and head of our growing General Mental Health Counseling and Assessments Department, otherwise known as C&A. Whether you're looking to get you or your child tested for ADHD, autism, or additional learning difficulties, or more, or looking to move forward with counseling services to help with your depression, or looking to treat for your generalized anxiety disorder, our team is ready to stand by your side. So please find counseling and assessments at the Smart Center in this episode's description, or head to counselingassessments.org and book your free complimentary call with our team today. All right, enjoy the rest of the episode.
Let's move on to question number 4. This one's also interesting as well. I'm seeking advice for my 10-year-old son with ASD and selective mutism. He's bright, close to his younger brother, and has strong language skills, but struggles with social anxiety. Sertraline has helped him become more talkative and engaged. He participates more at school and has friends who find him funny. However, he still feels anxious in certain situations like drop off and walking across the schoolyard. He often isolates himself. Any advice on helping him continue to build social confidence? And just want to make a quick note that sertraline is a medication.
Yes, I was just going to say sertraline is an SSRI. Zoloft is the pharmaceutical name for that. And then sertraline is the generic term. So the child is on medication. So this child has autism spectrum disorder, ASD, and SM. One of the hallmarks of ASD is social uncomfortableness. How does that sound? So maybe he's funny and he's getting laughs from his friends, but most individuals with autism have a difficult time with the social puzzle, as I say, and that causes them some anxiety, some stress, causes anxiety and stress versus the typical social anxiety that we see that once they're comfortable, kids can do more and are more comfortable with their peers. Kids on the spectrum have a more difficult time with that social interaction, and they have a harder time understanding the social cues. And in the morning, walking in is probably where kids are hanging out, kind of gathering with their friends, and he may not feel a role there. He can maybe a class clown and get a lot of laughs in class because that's a very kind of set, structured situation. They're in class, they're sitting in their seat, or they're doing something. But walking in, he may not feel connected. I will say that having ASD or not, most individuals that I work with selective mutism, anxiety, having that anxiety, they like to feel, I keep saying it over and over, but control. They like to know what, when, where, and how. And that gives them that sense of control. And so for this child, again, not necessarily related to ASD, but more of the anxiety component of having kind of like a path, not literally a physical path, but kind of maybe a teacher meets them and then they walk in, or the parent, takes them to a certain spot so that the child knows. Sometimes walking into a classroom is hard. So having a set activity that they would do as soon as they get there. So like we have kids that have centers in the morning. So the child knows they get into the room, the teacher says, hey, choose one of the centers, or directs them to a center so that the child has a purpose there rather than having to socialize. Because that is the overwhelming challenge for kids with ASD is it's not just building comfort, it's the social puzzle that's very uncomfortable for them and gives them a lot of anxiety and causes a lot of avoidance. And so if walking in is giving that child the sense of anxiety and not feeling secure, we need to work from that standpoint of helping that child feel more secure walking in and knowing what, when, and where. And sometimes it's drawing it out. Sometimes it's knowing what their path is. It's making sure the teachers are aware. And that's something that we can adapt in their IEP.
Yeah, it seems like these moments that are a little bit less controllable for the child is giving them stress. Like, obviously you go through the school day, you go to class. It's almost like more controllable. You just kind of know what to expect. And then you get in these sort of like open-ended environments like drop off where there's like a million things can happen. And it's like, you just don't know. You can't really, it's like overwhelming. It's contaminated.
So think about it, a 10-year-old child, right? Kids they're not 5, or they're being walked in, dropped off, playing Play-Doh, going in the housekeeping area, drawing, whatever they're doing. They're 5 or 6. This child's 10. They're social. he has autism spectrum disorder, right? So now he's walking in, either coming off the bus or the parents are doing drop off, and the kids are hanging out, they're laughing, they're playing ball, they're talking about things that are going on. He probably doesn't feel comfortable in the social nuance aspect of this and conversation starters and what to do, how to do it. And the social puzzle causes him stress. So that to me is probably the underlying theme. But then to work on that kind of walk-in process to give him that sense of control is what I recommend.
All right, let's move on to the fifth and final question of this episode. This one's a bit longer, a lot of different moving parts. So interested to get your perspective. For a 4-year-old who is selectively mute at daycare and also exhibits all 4 of the quad, what do you recommend for a treatment plan, especially given that so many of the challenges are exacerbated or perpetuated by the school environment? For example, the school requires a pull-up diaper to prevent accidents, and this child is unwilling to eat at school, etc. Should initial treatment focus on courage and speech only, or should it focus on aspects of the quad at home and outside the school? In other words, where should treatment start if we were to maximize the highest chance of progress while also balancing the ask of the school and not overwhelming this child? And how would you proceed once progress is beginning to be made?
Yeah. So this again is a really a lot here in this, a
Yeah,
lot of meat in this question.
they usually are.
Yeah, no, I mean, the families writing in, they don't know what to do, right? And they want recommendations and advice. So there's going to be a lot there in some of these questions. And I'm happy to do this, which is why we do this. I will say an evaluation, I keep saying that because the term selective mutism implies child isn't speaking. Let's do whatever we can to get them to talk. And a clinician working with this population that has a lot of experience knows that that's just the tip of the iceberg. That's just not where the focus should be. Speaking will occur when we can set this up right, and that involves understanding the child. So whomever you are working with should definitely do a full evaluation to determine what those child's unique needs are, because until things are in place, you're not going to have a successful outcome in my mind. So what we do is we do the selective mutism evaluation, and that evaluation involves a developmental history, which includes the quads, right? The quad, let me explain what that is. It's toileting challenges, eating challenges, sleeping, and behavioral difficulties. I call it the quad because kids can have all of those 4 things. Maybe they only have 1 or 2. I will say the more that a child struggles with the quad, the more that they have sensory challenges. And sensory processing challenges is definitely a Y of SM. What that means is that's a factor into the development and perhaps the maintenance of it. So that if we don't understand those child's needs, that they may have some sensory processing challenges and they're very sensory sensitive, most likely, then that's going to not allow for a real smooth treatment, frankly. It's going to be very frustrating. In addition, I'd want to understand that child's baseline stages of social communication in school. What are they like one-on-one with their teacher, with peers? How are they communicating in small groups and large groups? How are they doing with tasks? The child's 4. Are they completing tasks on time? Do they need redirection? Are they functioning at basically their age level? Like I need to know that, right? To develop
Yeah.
school-based accommodations and interventions. And so once we know all that, then it's a comprehensive treatment. And that
Yeah.
comprehensive treatment involves dealing with educating parents, right? Educating the school, but starting to work through the quad behaviors. Why does this child have the toileting issues? Is it a social anxiety? There's a term called paruresis that starts really young, which is kind of shy bladder syndrome. They won't go to the bathroom outside the home. And that's a social anxiety trait. So maybe this is a shy or timid child with sensory sensitivities. And so we have to address that and get that set up and get accommodations. Maybe this child needs an IEP. So going through an IEP evaluation to be able to get the accommodations and interventions to be able to meet that child where they're at and develop a step-by-step treatment plan. So it isn't just one thing. You're going to be working on everything. We're going to be working on toileting. We're going to be working on the sensitivity of eating. Maybe they're a picky eater from their sensory sensitivities. You can't force them to eat pretzels if they don't like it. So you have to kind of understand that, respect that. And again, toileting issues, behaviors, maybe this child needs more structure, consistency, routine, predictability, working with daily, weekly, and monthly calendars so they know what, when, and where. There's so much at stake with just developing a treatment plan. There's so much to do. But the good news is once there's an understanding of a child, once you understand their needs, their unique presentation, then the individualized treatment plan is developed for at home to deal with the quad, to deal with parenting, to know how to parent this child, how to educate aunts, uncles, relatives, how to deal with play dates. Where do you start with play dates? How do you bring the child into social communication? Who are the children you start with? How do you get play dates at the home versus somebody else's home? Where's the best place to start? um, in the real world, in the community, practicing in stores and restaurants, out and about. That's going to build, well, consistency, but it's going to help your child make the progress, which will then carry over into other environments. Educating aunts and uncles and adult friends on how to question, when to question, bringing a bag of props of high interest activities that can be, you can see it's going on, and educating the staff, like having an IEP in place for this child. If this child is struggling in these areas, not just put a pull up on, but, let's figure out how we can help this child. I mean, they're only 4, so they're not 6 or 7. So, but definitely working on that. I mean, we will have parents go to the bathroom with the child. Then we chart it where the parent takes 2 steps out, charts the child goes to the bathroom. The child's aware, takes 5 steps out, and then eventually the child's going to the bathroom in the school bathroom. If they are a sensory sensitive child, they may not feel comfortable going to the bathroom in a public bathroom in school where all the kids go. So there are times that they have to go into a different location or go when there's few people around. Maybe it's the loud flushing toilets for a sensory sensitive kid. You see what I mean? So you can see that there's so many angles, again, avenues you go down when trying to develop a treatment plan for all aspects of that child's life. It's getting a full understanding of that child's needs in all ways and figuring out what those whys are to accommodate those whys, understand those whys, and begin to make the progress through understanding the child's baseline stage and teaching the teachers the strategies, interventions to where they're starting at to move them across the bridge.
I just want to make a note that we actually covered the quad pretty extensively in episode 7 of the Unspoken Words podcast. So if you haven't listened to that episode or you haven't listened to it in a while, I would go back and listen to that. But to answer this question specifically before we wrap up, it sounds like the focus should be sort of on the quad first, right? Like those are the most stressful pieces for this 4-year-old. And is that the area you attack first? That's kind of what they're asking?
What I'm getting from this is the courage to speak and kind of focusing right at that speaking part and being brave to talk without realizing that if we're not addressing these other issues, but the quad is one aspect. You are not ignoring the parent education to bring that child into social communication opportunities through developing strategies. Like, for example, the parent can still go to a restaurant, have the visuals of what that child wants. The parent might start out in this case of, do you want this or that? No answer, this or that. Tell me, use a verbal intermediary, maybe with just a, what do you want? And a visual prompt, the child answers, I don't know this child, but you still are training the parents for social communication to bring that child into social communication opportunities. And in addition, you are going to, comfort precedes communication. So you're dealing with the quad and you're dealing with social communication. So what I don't love is the focus on talk, 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 being brave to talk here when this child has other issues. I would say they're being brave just to show up, and maybe they're brave to just hand over, take over. I don't know. But I feel kids, like, I don't focus just being brave to talk. I focus on the whole person and giving them the confidence, the independence, and the structure they need from a compassionate understanding standpoint to make that progress. I mean, we see this at camp all the time. These families come in and just the change in their way of talking to their child from day 1 to 2 makes such a change. I say this so often that if we did a communicamp where it was just parents and no children, you'd still see progress, because the training we do for parents will allow for that progress to be made, because they're changing the way they talk to their child. They're changing how they can bring their child into social communication opportunities. They're understanding their child's needs. And of course, working with the children are important too. Of course, that's a big part of it. But I'm just
Right.
saying that parent education and training from all perspectives. I mean, for this
Yeah.
parent, educating aunts and uncles about my child worksheet, right? On how to question, where to question, when, avoiding direct eye contact. The child brings a bag of props to sit down. There's so many things to do. Who are you focusing on play dates with? Obviously, school peers would be ideal. And those are the kids that the teacher pairs, groups, and sits with, that child, right? How they sit in a large group near the teacher, near their buddies. If the child makes progress with the friends at home, we transition the speech into school. Do you see what I mean? So you're never isolating out, let's just work on the quad. You're working on the whole person at the same time.
Yeah.
But you're meeting them where they're at.
Well, I've always said at camp and even on this podcast, this is like it's a lot of it is parenting first. It's not really a selective mutism podcast. It's really a parenting podcast. All right. Well, that wraps up this episode of Ask Dr. E. Thank you, Dr. E, for your time, and looking forward to doing another one soon.
Thanks, Bran.
All right. Bye.
Thank you for listening to Unspoken Words, a selective mutism podcast hosted by me, Dr. E, and the Smart Center. This episode and all episodes of Unspoken Words is produced by New Edition Productions. Don't forget to submit any questions you have from today's episode using our Ask Dr. E form on our website. Just head to selectivemutismcenter.org/ask-DRE. I'd love to answer your question in a future episode or blog post. Remember, for the best of this episode and every episode of Unspoken Words, please follow the podcast on Instagram and YouTube. We are at Unspoken Words _podcast on Instagram and Unspoken Words by DRE on YouTube. Or join our newsletter for additional SM content. We release new episodes every other Monday at 6 a.m. Eastern Standard Time. We'll see you next time.